Welcome back to Natural Mind and Body, your go-to channel for all things related to health, wellness, and natural living. Today, we're diving into a condition that affects millions of women worldwide, but is often misunderstood: endometriosis. If you've been experiencing chronic pelvic pain, irregular periods, or fertility challenges, endometriosis could be a part of your story. So, let's talk about what it is, what causes it, and what you can do to manage the symptoms naturally and medically. What is endometriosis? Endometriosis is a condition in which tissue similar to the lining of the uterus, called the endometrium, begins to grow outside the uterus. This tissue can be found on the ovaries, fallopian tubes, or other organs in the pelvis. The problem is that, just like the lining of the uterus, this tissue builds up, breaks down, and bleeds during the menstrual cycle. But because it's outside the uterus, the blood has nowhere to go, causing inflammation, pain, and sometimes scar tissue. While it's still being researched, endometriosis is estimated to affect around 1 in 10 women of reproductive age. Despite being so common, it can take years for many women to receive a proper diagnosis. So, how do you know if you might have endometriosis? Here are some of the most common symptoms. Chronic pelvic pain, especially before and during periods. Heavy or irregular periods. Pain during intercourse. Pain with bowel movements or urination, particularly during menstruation. Fatigue. Infertility or difficulty conceiving. It's important to note that the severity of the symptoms doesn't always reflect the extent of the condition. Some women with severe endometriosis might have mild symptoms, while others with less severe cases might experience a lot of pain. Now let's talk about what causes endometriosis. The exact cause isn't fully understood, but there are a few leading theories. Retrograde menstruation. This occurs when menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body. Genetics. If your mother or sister has endometriosis, you may be more likely to develop it as well. Immune system issues. Some researchers believe the immune system may not properly recognize and destroy endometrial-like tissue that grows outside the uterus. It's important to remember that endometriosis is not your fault. It's a medical condition, and there are ways to manage it and reduce its impact on your life. While there's no cure for endometriosis, there are several treatments that can help manage the symptoms. Some are medical, some are surgical, and others are natural and holistic approaches. Let's look at a few options. Eating a balanced diet, rich in anti-inflammatory foods like leafy greens, berries, and omega-3 fatty acids can help reduce inflammation and ease symptoms. Reducing processed foods and sugar can also have a positive impact. Some women find relief through herbal supplements like turmeric and ginger, both of which have anti-inflammatory properties. Regular gentle movement like yoga or walking can help improve blood flow, reduce inflammation, and release endorphins, which are your body's natural painkillers. Applying a heating pad or hot water bottle to your lower abdomen can help relax the muscles and reduce pain during flare-ups. For women with severe endometriosis or those who don't find relief through natural methods or medication, surgery may be recommended. Laparoscopic surgery is often used to remove endometrial tissue that has grown outside the uterus. This can significantly reduce pain and improve fertility for many women. It's important to discuss with your doctor whether surgery is the right option for you. Managing stress is key since it can worsen symptoms. Practices like meditation, deep breathing exercises, or even spending time in nature can help you feel more balanced. If these natural methods aren't enough to relieve your symptoms, it's important to speak with your doctor about other treatment options, like hormonal therapy or surgery, to determine what's best for you. If you're struggling with endometriosis, remember, you're not alone. There are millions of women experiencing the same challenges, and while endometriosis can be a difficult condition to manage, there are solutions out there to help you live a healthier, more comfortable life. I encourage you to listen to your body, find what works best for you, and always seek professional advice when needed. Thank you for watching, and if this video helped you, give it a thumbs up and subscribe to Natural Mind and Body for more content on women's health, natural remedies, and overall wellness.